Hi, my name's Bree. I'm going to be your nurse today. We're going to be doing a full head-to-toe assessment. Is that okay?
That's fine.
Do you need to use the restroom beforehand?
No.
Okay, I'm going to start by asking you a few questions. Can you tell me your name and date of birth?
Johnny Sims, 9/30/66.
Do you know where we are?
At home.
Do you know the day
Friday,
and the year?
2022.
Okay, if you saw somebody breaking into a car, what would you do?
Call the cops.
Okay, patient is alert and oriented times 4. Speech is spontaneous, clear, and logical. Abstract reasoning is intact. General appearance, patient looks to be well kept, clean, is relaxed. Behavior and mood is appropriate for the situation. So I'm going to start off by looking at your scalp and your head. I'm going to touch you, okay?
Okay.
Okay, any tenderness?
Nope.
No tenderness is noted. Head is normocephalic. No lesions or masses are noted. Hair is evenly distributed and is clean. Scalp is intact. Now I'm going to move on to your eyes. I'm going to take a look at your eyelids. Eyes are symmetric with the rest of the face. The eyelids are not drooping. Conjunctiva is pink and moist bilaterally. Sclera is white. Eyelashes are evenly distributed. Have you look at my finger for me? I'm going to shine a light. And my other light. I'm going to do it one more time. Okay, and I'm going to have you look at my finger. Look at the wall behind me. Look at my finger. Now follow it. Okay. Pupils are equal, round, reactive to light and accommodation. Reaction is brisk. Pupils are about a size 4 and they are round. Now I'm going to have you look at this chart for me and read. I'm going to have you cover one eye and read the smallest line you can. In a real instance, this would be 20 feet away.
FELOPED.
Okay, cover the other eye. Read the same line.
EDRCZP.
Okay, now both eyes together.
EDFCZP.
Okay, so based on the chart, patient's vision with both eyes is a 20/30. Now I am going to palpate your maxillary and frontal sinuses. So frontal, maxillary. Any pain or tenderness? No pain or tenderness is noted. If I had an ophthalmoscope, I would assess for the red reflex in the eyes. I don't have one, so I'll verbalize and use my pen light. I'd look in the patient's right eye with my right eye, patient's left eye with my left eye. For video purposes, we'll say this is intact. Now I'm going to move on to the ear. Any pain or tenderness? No pain or tenderness noted upon palpation of the pinna, mastoid, and tragus. Outer ear looks clean and intact. Recesses bilaterally. Any pain or tenderness?
Nope.
Okay. No drainage is noted. If I had an otoscope, I would use it to assess the internal membranes of the ear and the tympanic membrane. I don't have one, but if I did, I would hold the speculum in alignment with the nose. But I'll just use my pen light. I'll pull up and out and assess. No drainage is noted. The tympanic membranes are intact and they are a pearly gray color, and that is bilaterally. Now I'm going to have you cover one ear. I'm going to step off to the side, whisper something, you tell me what you hear.
Football.
I'm going to come on the other side.
Apple.
Okay.
I couldn't hear you for some reason.
Hearing is intact. Slight hearing difficulties on the right side. Now I'm going to look at the patient's nose. It is symmetrical with the rest of the face. There is no drainage noted. I'm going to have you look up a little bit. Septum is intact. Nasal mucosa is pink, moist, and intact. Turbinates are visible. Septum is midline. I'm going to have you cover one nostril. Close your eyes and tell me what you smell.
Alcohol.
Okay, we're going to do it on the other side. Eyes closed. What you smell?
Alcohol.
Okay, Okay, so patency of the nares is intact. Now I'm going to move on to the mouth. So the lips are dry and intact. There are no lesions noted. I'm going to use the tongue depressor. I'm going to have you open your mouth, stick your tongue out. Okay, tongue is midline to the body. The oral mucosa is pink, moist, and intact. Tonsils are present. Hard and soft palate are intact, pink and moist. No decays or caries noted on the teeth. All teeth are present. I'm going to have you I'm going to palpate your trachea. It's midline. Any pain or tenderness?
Nope.
No pain or tenderness is noted. I'm going to palpate your carotid pulse. 2+. 2+. I'm going to auscultate your carotid pulse with the bell of the stethoscope. Okay. Okay, no bruits are noted. I am going to have you take a drink for me, and I'm going to palpate your thyroid. If you don't care to relax your shoulders for me and your neck, and take a sip. Okay, any pain or tenderness?
Nope.
Okay, thyroid is palpable. No enlargement is noted. No pain or tenderness is noted. Now I'm going to assess your lymph nodes. I'm going to start with the prearticular, the postarticular, occipital, tonsillar, submandibular, and submental. Any pain or tenderness?
Nope.
No pain or tenderness noted. The posterior cervical, superficial cervical, deep cervical chains, the supraclavicular and infraclavicular. Any pain or tenderness?
Nope.
Okay. Have you open your arm for me? We'll do the central, lateral, pectoral, and subscapular. Any pain or tenderness?
Nope.
No pain or tenderness is noted. All lymph nodes, there was no pain or tenderness, and no enlargement was noted. Now I'm going to move on to your upper extremities. Just take a look. Skin is warm, dry, and intact on the upper extremities. Capillary refill is less than 3 seconds. I'm going to palpate your brachial pulse, 2+. Radial pulse is 2+2. Okay, now I'm going to have you shift to the side a little bit.
This way.
The AP diameter is a 1 to 2, which is normal. I'm going to assess the posterior skin. Any pain or tenderness?
No.
No pain or tenderness is noted. Slight discoloration of the neck is noted. No lesions, masses, or abnormalities are noted. I'm going to palpate the spinous processes. Any pain or tenderness?
No.
No pain or tenderness is noted. They are palpable. No enlargement is noted. I'm going to have you take a deep breath in for me. Breathe out. Chest expansion is equal bilaterally. Now I'm going to percuss the posterior lobes. Okay, I'm going to do the other side. Okay, so resonance was noted upon percussion, which is normal. I'm gonna thump your back. You let me know if you feel any pain. Any pain?
Nope.
Any pain?
Nope.
Okay, no CVA tenderness is noted. I'm going to auscultate the posterior lungs bilaterally. Take big deep breaths in for me.
Hey, step around a little. Breathe.
Okay, posterior lungs were clear and equal bilaterally. I'm gonna have you face forward for me. And now I'm going to assess the anterior skin. Any pain or tenderness?
Nope.
No pain or tenderness noted. Skin is warm, dry, and intact. No lesions or masses are noted. I'm gonna just assess your breathing and rate for a little bit, so just sit there for me and breathe normally. Okay, so patient's breathing is relaxed and unlabored. No bulges or retractions are noted. Rate was 16. I'm gonna have you lay back for me. If you don't care to bend your knees some for me, I'll cover you up. Okay, I'm going to listen to your anterior lungs, okay? You put your arms down to your side for me. Okay, anterior lungs were clear and equal bilaterally. Now I'm going to palpate for any heaves, lifts, or thrills. No heaves, lifts, or thrills were noted. I'm going to palpate the apical pulse, which is left midclavicular, fifth intercostal space. It is palpable. Now I'm going to listen to your heart sounds with the diaphragm and bell with my stethoscope. Start with the bell. We're going to start with the aortic, pulmonic, herbs, tricuspid, and mitral. And I'm going to listen the same with the other side. Aortic,
Say it loud.
pulmonic, herbs, tricuspid, and mitral. And now I'm going to listen to your apical pulse for 1 full minute. Okay, so S1 and S2 was noted. No roots were heard with the bell of the stethoscope, and the apical pulse rate was 65. Now I'm going to move on to your abdomen. I'm going to cover you up a little bit. If you don't care to raise your shirt for me and flex your knees up. Okay. Upon general inspection, skin looks to be clean, dry, and intact. Skin is warm. No pulsations are noted. Hair is noted on the abdomen as well. I'm going to auscultate all 4 quadrants. Okay. Bowel sounds are audible and normal, active in all 4 quadrants. I'm going to percuss your abdomen, okay? Okay, tympany was noted upon percussion in all 4 quadrants. I'm going to start with live palpation. Tell me if you feel any tenderness or pain. Any pain or tenderness?
Nope.
Any pain or tenderness?
Nope.
Any pain or tenderness?
Nope.
Okay, so no pain or tenderness noted with light palpation. I'm going to go a little deeper. Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
And any pain?
Nope.
No pain or tenderness noted upon deep palpation. I'm going to do the same thing, but do it quickly. You let me know if you feel any pain. Any pain?
Nope.
No pain on rebound. Now I'm going to palpate the border of the liver. Any pain or tenderness?
Nope.
Okay, liver border is palpable. No enlargement is noted. Now I'm going to auscultate the aorta, renal arteries, and the femoral arteries with the bell and my stethoscope. Aorta. Renal arteries. And femoral. Okay, now I'm gonna palpate the aorta. No pulsations are noted. Light palpation or light pulsations noted in the renal arteries and the femoral is 2+ bilaterally. Okay, I'm gonna have you sit up for me. Put your shirt back down. And I'm going to assess your lower extremities. Okay, so skin is warm, dry, and intact. Some dryness noted on the knees. No varicose veins or edema is noted. Capillary refill is less than 3 seconds. Bilaterally. I'm going to palpate your posterior tibial pulse. 2+ bilaterally, and the dorsalis pedis pulse, which is 2+ bilaterally. Now I'm going to take my first look at my paper. I'm going to have you lay back down for me one more second, and we're going to have your knees bent up, and I'm going to have you flex your head forward. I'm going to assess for any hernia. Okay? Any pain or tenderness?
Nope.
Okay. So no hernia is noted. You can sit back up for me. Now we are going to assess your cranial nerves. So we will start with cranial nerve 1, which is the olfactory nerve. I'm going to have you close your eyes, and I'm going to have you smell something for me. Can you cover one nostril for me? Tell me what you smell. Okay, other side.
Alcohol.
Okay. Cranial nerve 1, the olfactory nerve is intact. So now I'm going to have you look at me, and I'm going to hold up some fingers. You tell me how many I'm holding up, okay?
2, 1, 2, 3.
Cranial nerve 2, the optic nerve, is intact. So for cranial nerves 3, 4, and 6, which are the oculomotor, abducens, and trochlear nerves, I'm going to have you follow my finger with just your eyes. Okay, and I'm going to have you just look at me for a second. No nystagmus is noted, so cover one eye, uncover, cover the other eye. Okay. Cranial nerves 3, 4, and 6 are intact. We're going to assess cranial nerve 5. I'm going to have you open your jaw, close your jaw, clench your teeth. Any pain or tenderness?
No.
No pain or tenderness noted, and I assess TMJ as well. I'm going to have you close your eyes and you tell me if you feel a soft sensation or a sharp sensation, okay?
Soft. Hard. Sharp.
Mm-hmm.
Soft. Soft. Sharp. Soft.
Okay, so cranial nerve 5, the trigeminal nerve, is intact. For cranial nerve 7, I'm going to have you look at me, smile, frown, raise your eyebrows. Cranial nerve 7, the facial nerve, is intact. For cranial nerve 8, the auditory nerve, we would use a tuning fork and do the Weber and Rhine test. I would place the tuning fork at the midline of the skull or at the base of the mastoid, but I don't have one, so we'll do the whisper test in place. So I'm going to have you cover one ear. We'll step off to the side.
Apple.
Okay. We're going to do the other side. Great.
Great.
Okay. So cranial nerve 8, the auditory nerve, is intact. We're going to assess cranial nerves 9 and 10, which is the glossopharyngeal and the vagus nerve. I'm going to have you open your mouth and say ah.
Ah.
Okay, swallow for me. Now we're going to test your gag reflex. Okay. Cranial nerves 9 and 10 are intact. For cranial nerve 11, which is the spinal accessory nerve, I'm going to have you shrug your shoulders against resistance. Shrug up against resistance. Push your head against resistance. Other way. Other way. Okay. So cranial nerve 11, the spinal accessories are intact. I also assessed the trapezius muscle and the sternocleidomastoid muscles, and they are a grade of 5. Now I'm going to assess the hypoglossal cranial nerve, which is cranial nerve 12. I'm going to have you look at me, stick your tongue out, up, down, side, side. Okay, cranial nerve 12 is intact. So I have assessed all the cranial nerves. They are all intact. Now I'm going to have you stand up for me. I'm going to have you walk a couple steps.
Just one?
And walk back. Okay, so gait is steady and balanced. I'm going to have you, I've assessed the iliac crest, that it's symmetric with the rest of the body. No curvature is noted. I'm going to have you bend forward and let your arms hang. Okay, no scoliosis is noted. You can stand back up. No kyphosis is noted when the patient comes back up. So now I'm going to have you walk heel to toe a couple of steps. Okay, now come back. Okay, now I'm going to have you face me with your eyes closed and just stand there. Okay, patient passed the Romberg test and cerebellar functions are intact. I'm going to have you stand on one foot. Okay, all cerebellar functions are intact. Now I'm going to have you sit back down for me. And we are going to do, can you do this for me? Okay, now finger to nose. Finger to nose. Fine motor skills are intact. So now I am going to assess sensation in the upper and lower extremities. I'm going to have you close your eyes for me. You let me know when you feel me touching you, okay?
Okay. Yes. Yes. Yes.
Okay. Distal and proximal sensations are noted in the upper extremities. Same thing, eyes closed. Let me know when you feel a sharp or a soft sensation.
Soft. Sharp. Soft. Sharp.
Okay, so all sensations are noted in the upper extremities. I'm going to do the same thing for your lower legs. You let me know when you feel me touching you.
Okay. 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 Okay.
Okay, so distal and proximal sensations are noted. Same thing with sharp and soft sensations.
Mm-hmm.
Is it sharp or
Oh,
soft?
soft. Soft. Sharp. Soft. Sharp.
Okay, so full sensations are noted in the lower extremities. Now I'm going to have you close your eyes and hold your hands out. I'm going to place an object in your hand and you tell me what you feel.
Oh, you put on hand.
Okay, close your hand. Tell me what you feel.
Quarter.
Yeah. We're going to do the other one. Tell me what you feel.
Quarter. Key.
Okay. Sterignosis is noted and is intact. I'm going to do the same thing. Have your hands open and you tell me, eyes closed. Tell me what you feel.
Fingers.
What am I drawing?
Circle.
Okay, we're going to do this one.
Circle.
Okay, so graphesthesia is intact. Okay, can you open your eyes for me? I'm going to have my last look at my paper. Okay, so now we're going to assess range of motion. Could you do your head up, down, side, and side for me? Shrug your shoulders. Shrug your shoulders.
Oh.
And then twist. Okay, so range of motion is intact in the upper or in the neck and in the spine. Now have you shrug against resistance again and move your head against resistance. Okay, so muscle strength in the neck and in the spine is a grade of 5. I'm going to do the same for your upper extremities. First, can you move your elbows for me?
Which one?
In and out.
Oh, in and out.
Same with your wrists and then your fingers. Okay, so no warmth, any tenderness?
Nope.
No tenderness noted and no crepitus is noted in the upper joints. I'm going to have you push against my hands, pull against my hands. I'm going to have you squeeze. Okay, so, okay.
There you go.
So full range of motion is noted in the upper extremities and muscle strength is a grade of 5. I'm going to have you bend your knees for me, both of them one at a time. So this knee up and down, the knee, bend it.
Oh, man.
This one. Okay, same with your ankle. Wiggle it around for me. Okay, ankle, wiggle it around. You want to do your toes? Wiggle those. Okay, so any tenderness or pain?
No.
Okay, no pain or tenderness is noted. In the joints of the lower extremity, I'm going to have you push against my hands. Okay, pull. Same with your feet, push up and then pull. Okay. Full range of motion is noted in the lower extremities and muscle strength is a grade of 5. Now I am going to test your deep tendon reflexes. In a real world situation, I would use a reflex hammer. For video purposes, I will use my stethoscope. So I would assess the brachioradialis, the bicep, and tricep. I would do that bilaterally. And tricep. And then the patellar. Okay, and then the Achilles. All reflexes are intact. Now I'm going to assess the plantar reflex. I'm going to see your foot. I'm going to run this on the bottom and you let me know when you feel a sensation or when it tickles. Okay. Same with this one. Okay. So plantar reflexes are intact. And this concludes my physical assessment.